like subarachnoid hemorrhage, contusions, epidural hematoma, subdural hematoma. Okay, talking about subarachnoid hemorrhage. Okay, what is subarachnoid hemorrhage? It is usually frequently caused due to rupture of berry aneurysm. Due to rupture of berry aneurysm, it causes severe, sudden headache. Okay, usually it's also called thunderclap headache. Okay, now usually in intracerebral hemorrhages we also have headache, but it's not as severe as when you rupture your berry aneurysm. That is subarachnoid hemorrhage. Berry aneurysm is nothing but the saccular outpocketing. It means it doesn't have media, it has only the intima and adventitia. Okay, when you see the layers histologically. And now talking about this contusions are nothing but the bruise of the brain. Usually involves the orbital gyri and in the frontal region and the temporal poles. In addition, we can see the coup and counter coup. Now coup is something that at the site of injury, okay, and counter coup is something that dramatically it's opposite to the injury. For example, how do I describe it? It's just something that you're driving in a car. Okay, you're driving in a car, and this is your steering wheel. You hit your head here, that's coup, and the opposite to that, the cerebellum behind or the brain behind hits back to the skull. That will be the counter coup. Okay, now moving on to the epidural hematoma. Now what is epidural hematoma? It's always due to trauma to the skull. Most important part involved is pterion, near the temporal side of the lobe. It usually involves the middle meningeal artery and not middle cerebral artery. Okay, this is one of the important thing which has been always confused. Okay, this leads to cerebral hematoma. And one more important thing to be remembered with epidural hematoma is the lucid interval. How do I like to describe is the period of consciousness between unconsciousness. This helped me remember, like, the person meets with an accident, and he gets up and talks something a bit, and 1 hour later in 1 hour he go back to sleep or coma, like that. Okay, now when you see in MR or CT, you can see the shape appearing as convex. Okay, convex or lenticular shape. Okay, it's called epidural or extradural. It's outside the dura mater, so that's why it's called. Now talking about the subdural hematoma, it's due to rupture of bridging veins from cerebral convexities. Okay, it's usually due to trauma, and also it includes brain atrophy, usually due to shearing force, and also it can be observed in alcoholics. Okay, when they get drunk and hit their head, they are very susceptible to this subdural hematoma. Seizures are also predisposed to subdural type of hematoma. Okay, and one more important thing you need to know about this, you will have headache, drowsiness, and so you will see focal neurological deficits. Okay, winding up everything. So this is how will have the central nervous system traumas. Okay, and one last thing I want to emphasize is in the subarachnoid. In subarachnoid hemorrhage, there is something called one-third theory. One-third theory, that one-third die, one-third rebleed, one-third recovers. Okay, one-third die, one-third rebleed, one-third recover. Okay, so the prognosis with subarachnoid hemorrhage is not very good. It's worst headache of life. The patient complains and comes to your clinic telling it's the worst headache in my life.